Thank you, Mr. President. We are here to point out that there are an awful lot of Americans who are winning because of the Affordable Care Act. Whether it's a mom with kids who've gotten out of college but can't get health care, couldn't get health care on their own, but now can stay on mom and dad's policy, and that's one less thing for her to worry about her 22-year-old, 23-year-old children. That's a pretty big win. Whether you're Olive, a Rhode Islander who's been in touch with me up in Woonsocket, who used to go into the donut hole every year because her husband has Alzheimer's and needs expensive medication, she saved $2,400 a year in the first year alone. That's a significant benefit for Olive. We have people who are trapped in their jobs because they couldn't get away. They were chained to their jobs by the need for insurance. Elena from Warwick was one such person. She was working at one of our universities. She liked her job okay, but she really wanted to be a web entrepreneur, but she was tied to her job by the employer-supplied health care. She went to HealthSource Rhode Island, our exchange, back in December, and she found a plan that worked for her. The plan's premium was so low that she told me it, quote, sent her over the moon. And she has become the proud owner of her own Rhode Island small business because she had the confidence that she could go forward. Stories like this abound, not just in Rhode Island, but across the country. When I first came into our Rhode Island Health Exchange, the first person I saw was the person ahead of me in line. They were there with boxes of Dunkin' Donuts and two big of those carry boxes of coffee. And they'd brought them in because they'd come in earlier in the afternoon. They'd been served by the people who were working there. They'd gotten health insurance for the first time for that family. They were thrilled, so they wanted to bring back as a thank you donuts and coffee. That's the story that we see. And I will say, we got to remember as we were going into this what the problem was that we were looking at. And this is an area where we should be working together. Look at where the costs were going. That's healthcare cost. In 1960, $27 billion, $2.7 trillion in 2011. This was out of control. This was not going to be sustainable. Something absolutely positively has to be done to get health care under control. And the unsung part of the Affordable Care Act is the part that begins the change in our delivery system reform so we can make our system affordable. Do we do it by taking things away from people? No. We do it by making the system better. And how do we know that will work? How do we know that will work? Here's a graph of all major countries that are various kinds of competitors with us. Switzerland, Norway, Netherlands, Great Britain, Japan, and the rest basically of the major industrial nations. And if you plot their life expectancy in years of their population against how much they spend per capita on health care, you get a pretty solid grouping right through here, and you get a pretty clear curve that can be drawn through that. Well, here's the USA. We are way more than the most expensive country, way more per capita, better than $2,000 per person more per capita than the most expensive other countries in the world. And look at us for life expectancy. We come in around Chile and the Czech Republic, and we are below all of our competitors. So there is huge room for improvement. Better health care at lower cost that will extend our lives and reduce the cost. If we just move back into this pack, we'd save $1 trillion a year in health care in this country. Not just the government, but across the country. It would help businesses, it would help taxpayers, it would help everybody. And there are ways to do it. Here's just one little example. People who get readmitted after they've gone into the hospital. Now, what was happening is that people were getting out of the hospital and they were going back to their nursing home or back to their house, and their discharge planning hadn't been very good, and their doctor may not have even known they were getting out, and they didn't know what to do with their medications. And so what happens? A week later, 2 weeks later, 3 weeks later, a month later, they're back in the hospital again. So we decided to do something about it in the Affordable Care Act. And look, this is the readmission rate. It was rocking along around 19%. Then along comes our bill in 2011, and it starts to drop. And it starts to drop pretty dramatically. And if we can keep that up, we save the money of all of those readmissions. You don't pay for a readmission that never happens. It is an absolute economic savings. Plus, the family doesn't have to worry about grandma going back into the hospital again and picking up a hospital-acquired infection or some other cost like that. So I'll conclude. I want to thank the senator from Connecticut, Senator Murphy, for organizing us on the floor today. I want to summarize that there is a great human interest story to tell about the Affordable Care Act that is helping families not only in Rhode Island but across the country, and moreover, that it's a great tool for us, as I hope we can do working together, to improve our delivery system of health care so we're delivering better health care to Americans for a lower cost. We know that we can do it. For crying out loud, if Greece can do it and these other countries can do it, then by God, so can the United States of America. I yield the floor.